Francisco, you get the first question. When you compare Lowell to Boston's methadone mild problems, I think Lowell has made some great success with the problems we saw in the South Common and some of the other areas. But this year, the city eliminated 2 public health nurses. Can that be problematic going forward for testing, education, outreach, etc.? Should they have kept those public health nurses?
Definitely, those positions are more valuable for the community. Those positions deal with, you're talking about the nurses in the school system too?
Yeah, well, they're public health now.
Public health.
Yeah.
So no, those positions are more valuable to the people in the city. Again, we are a low-income community, and sometimes there's more needs for those types of services. I think we could have found the money to kept those positions.
Marcos?
Yeah, so I think we should be immediately reinstating those positions. I think we just went through a pandemic, and the major lesson that should have been learned is that your city needs to be prepared for any sort of illness that may come and impact your entire city for a lot of reasons. Simply for the moral reason of making sure your citizens are healthy, but also to secure the financial stability of your city. If you allow your city to be capable of being overtaken by a sickness, by an illness, or another pandemic, that puts your city in a financial crisis, having to deal with these the knockoff effects of that. So I think as city councilor, I would be a strong voice for ensuring that we are not cutting those positions, those community departments and those initiatives we know allow for a healthy and thriving city, such as the health department, such as the school department, such as the infrastructure department. I think we need to be making sure that we are not redistributing our resources away from these issues, and if anything, redistributing our resources towards them, because at the end of the day, our city is struggling in some of these areas, so we need to be making sure that we're not cutting back, but supporting these institutions.
Okay. John?
Yeah.
John DeCoe.
I guess I would ask the question to you, Marty. Is the South Common look the same as it did last time this year?
No.
Absolutely not. Do I want to cut the nurses? No. But we've brought more people on the ground. And in fact, I believe I received an email yesterday, the day before. We have 26 homeless people that we, in the last 4 weeks, that we are now in rehabilitation centers. That is huge, because last year at this time, when we sent somebody over, they would say, no, I ain't going, I'm not going. And you know what? This is a huge change, a huge culture change. That we have people that are willing to go into rehab for whatever gambling, not gambling, but like drugs. That's me gambling. I think it's working. It is working, and South Common is a lot better place, and even the areas outside it near the projects as well. So.